The width of your rib cage matters, all right? You may not notice this, but it's something that I notice as a physical therapist when I look at people during my evaluations. How wide is your rib cage? Is it more narrow? Is it wider? Is it more open on one side than the other? This can contribute to back issues. It can contribute to breathing issues. It can contribute to pelvic floor issues even. So, like I said, the width of your rib cage matters. I'm Dr. Christina, the Picky PT, and I get picky about things like the width of your rib cage. So let's talk about it today. And if you know that you experience issues with your pelvic floor, you have asthma, or you have mid-back pain, you should watch this video as well. And make sure to like and subscribe to this channel so you can always be up to date on the latest videos that I make about teaching you about your own body, teaching you about how to have more control over the aches and pains that you have in everyday life, and doing that with learning and understanding your body more and how to troubleshoot it. Like I said, there's lots of people that walk around with too narrow of a rib cage. This often happens whenever you're a breather, where you like to breathe up, or you even like to breathe into your chest, or even sometimes belly breathers. So this can cause your rib cage to narrow because of the lack of use of your intercostal muscles, the muscles that live in between your ribs. Also, you can have too wide of a rib cage, or a rib cage that opens on one side easier than the other. So when you breathe, you might breathe like this. Or you might notice like it always feels hard for me to breathe into one side. And asthmatics like me may notice this more often than the general population because we're the ones struggling with getting that breath in. You could also have too wide of a rib cage. If you walk around and you meet somebody that is really wide in their trunk area, then it can be that you don't have enough use of your core muscles to pull that rib cage in. So we're gonna go over a new and interesting way that you can do your rows in order to help with this issue, okay? So you're going to need to be at a cable machine, and you're going to need an attachment where you can pull that row using one arm at a time, right? So I'm going to step back for my row. I'm gonna make sure that I'm facing straight on to the direction that I'm pulling, okay? So I'm not gonna be twisted at all in one way or the other. I'm then going to row with one arm by setting my shoulder blade down and back on that side, and then pulling with my shoulder blade more, all right? We are not going to pull with just our bicep. We're not gonna pull with just our shoulder. We're gonna pull with our shoulder blade. Notice how open my chest is by doing that. And then we're gonna reach around to the cable, and we're gonna pull this other side back as well, all right? What this does is it allows you to widen your rib cage on one side and then widen your rib cage on the other side. So if you're a narrow rib cage person, then this exercise is gonna help you. All right, so we're pulling back with one arm, pulling across with the other, pulling back, and then we're going to set it back, set it back. You can do this for both sides, or you can do it focused on the side that you tend to lack opening on. So let's say I tend to open this way easier, then I would probably want to pull the second hand with this arm more, so I really pull that rib cage open, okay? So that would look like this, reach across and pull. Now, if you are someone who has too wide of a rib cage, it's too wide, and you need to narrow that rib cage by pulling your core in. As you do these rows, what you're gonna think about is you're going to pull back with one arm, and as you're doing that, you're gonna pull your rib cage back towards your spine as well. Too many times do I see rows look like this, where you're leaning forward into it, and instead you should be pulling back as you row. And then when you bring the other arm around and you pull, you're gonna pull that side back as well. This is going to engage your oblique muscles. That way you're pulling in that rib cage versus having it too wide, okay? Now for a back view, so you can see exactly how wide or narrow my rib cage gets as I do this, we're gonna row with one arm, pulling wide on this side. Notice how it got a little bit wider, and then we're gonna pull across. Notice how the other side got wider now. So now my whole rib cage is more open. And if you need to narrow that rib cage, we're not going to row like this. We're gonna row by pulling in, pulling in. Pulling in, pulling in. So these differences may look subtle to you, but as a neuromuscular expert, a physical therapist, I can look at someone's rib cage and tell, hey, I think your mid-back pain is coming from a lack of mobility in your rib cage on one side or the other or all together. Let's work on that so we can reduce your back pain, we can improve your asthma, we can reduce tension on your pelvic floor on one side more than the other, and you're going to be able to do these rows without fear of injury in the future.